We'll continue with chapter 1. The next concept is one of anatomical position. There's a need for consistent terminology. There's a need for consistent understanding of what one practitioner is saying to another practitioner. The real-world example of this is on a boat. Port and starboard are used on a boat. I was a very competitive sailor for a lot of years, and the skipper always referred to port and starboard, not right and left. We'd be working as a crew, and if the skipper yelled, "Turn right," then the guy running the winches, who's facing sideways, would turn one way. The guy on the foredeck managing the spinnaker would go a different way. The helmsman would go yet another way. When you say port, it means the left-hand side of the boat, and you move towards the left-hand side of the boat, no matter what position you're in. Anatomical position is the same idea. The idea is that you picture the body as if it's standing upright with the arms at the sides and the palms faced forward, so that when you say above, it means going towards the head, not going up. If somebody was laying on their back, above them would be the blankets, for instance, or like your chest would be above your heart. We can't have that because we'd have to explain the position of the patient in everything. So we say superior, meaning above the head, as if the person was standing upright. And it doesn't matter whether they're laying down or laying on their back, laying on their front, etc. So anatomical position ends up looking like this. Now you're going to see this this position in a lot of illustrations, but it is facing forward, palms facing forward, so that the radius and ulna don't cross. I will demonstrate that in class. So then we need consistency of language. In here, I'll come back to this stuff here. This is the regional terms, but we're going to talk about directional terms first. So when we talk about moving towards the head, we say things are superior. Sometimes we say cranially, and sometimes we say cephalad. Cephal is Greek for head. Cranium is head. Superior is above. So towards the head. If you're going to downwards, it's inferior, or caudal, which caudal means tail. So moving caudad is moving towards your tail. Now, interestingly enough, we don't use these terms when we're referring to the limbs. So really, inferior means moving towards your bum on your trunk. Moving towards the front of the body is moving ventrally or anterior. So we can say things like your pec major muscle is anterior to the heart. Your heart is anterior to your spine. Your spine is posterior or dorsal to your heart. etc. So dorsal means moving towards the back. Ventral and dorsal, very important things. When we use these terms, we have to give a you are here reference. So we say things like your thyroid is superior to your sternum, and it is anterior to the esophagus. That's how we orient things. Moving towards the midline is medial. Away from the midline is lateral, and in between 2 points is intermediate. So we can say that your shoulder is lateral to your sternum. We can say that the sternum is medial to the shoulder, and we can say that the clavicle is intermediate to the shoulder and sternum. It's just a way of describing it. So your heart is anterior to the spine, posterior to the sternum, left lateral to the midline, intermediate between the ribs and or intermediate between the two lungs, superior to the diaphragm, and inferior to the first rib. By using these terms, we can locate things. When we're talking about the limbs, the appendicular skeleton, we use the terms proximal and distal. So distal is towards the fingers and toes, furthest away from the trunk. Proximal is closest. So we can say things like the shoulder is proximal to the elbow is proximal to the wrist is proximal to the fingers. The elbow is distal to the shoulder, so we can say the elbow is distal to the shoulder but proximal to the wrist, and so on. So by using these terms, we can identify where things are. So you don't move up your arm, you move proximally. People mix up this one a lot. Superficial means towards the surface of the body, and deep means towards the center or away from the surface of the body. So, so the heart is anterior to the spine, posterior to the sternum, but we can also say that the heart is deep to the sternum and also deep to the spine because it's away from the surface of the body. A superficial burn is right on the surface of the skin. Superficial pain happens in the skin, deep pain happens in the bone, it's like growing pain, that sort of thing. Those are the way we use the terms. We talk about things in regional terms, and we're going to see that a lot of the anatomical names refer back to these regions. The body is divided into two major divisions. There's the axial part of the body, which is the head, neck, and trunk, and the appendicular, which is the limbs, the arms and the legs. And the regional terms are used to really designate specific areas of those major divisions. So a lot of it is in Latin or in Greek. So the head is the cephalic region. That's part of the axial skeleton, the part of the axial part. The forehead is the frontal, around your eyes is orbital, Your nose is nasal, around your mouth is oral, your chin is mental. Your neck is the cervical region. The thorax is your chest. Everything kind of above the diaphragm is thoracic. Now, along the sternum is the sternal region, breasts and chest area is mammary, armpits or axilla, the axillary region. Your abdominal region is your abdomen. The umbilical is around your belly button, and the abdomen actually gets divided into other regions, and we'll talk about that in a minute. There's the pelvic region is bound by the bones of your pelvis. It's below the abdomen. It's continuous with the abdomen. We call around your groin the inguinal region. So inguinal hernias are found down in the groin region, where umbilical hernias happen up on the center line in the abdomen. The pubic region is actually on the outside, so that's your genitals. In the limbs, the upper limb is the acromial, is the point of your shoulder. Brachial is the arm. Cubital is the elbow, so antecubital is the front of the elbow where you take blood. Antebrachial is your forearm. Carpal is your wrist. Manus is hand, so the palmar part of your hand. Your thumb is pollex, your fingers are digit. In the lower limb, we have a coxal region is the hip, femoral region is the front of the thigh, patellar region is your kneecap, crural is the leg, from the knee to the ankle, so along your shin. The fibular side, or the peroneus side, is the lateral side of the leg. Pedal is your foot. That's why it's podiatrists and pedestals. Tarsal is the ankle, metatarsal is the foot, digital toes, halix is the big toe. On the back, we do the same thing. So a lot of it is the same. So the back of the elbow is the olecranon. So the calf is the sural region. On the foot, the sole of the foot is the plantar region, and the heel is the calcaneal region. In the head, occipital is the back of the head. Around the shoulder blades is scapular. Along the spine is vertebral. Lumbar is in the low back. It's kind of your waist. Gluteal region is your bum. Perineal is around the anus. The body can also be thought of as being cut up into planes, flat surfaces that basically will divide the body. Usually it's imaginary. The sagittal plane divides the body into left and right, and we call any cut along that left and right the sagittal section. If it goes right down the midline, it's called mid-sagittal or the median plane. Any other sagittal plane is called parasagittal, and it's not on the midline. Anything that divides you into front and back vertically, anterior and posterior, is a frontal plane. If it runs right down the middle, it's called the coronal plane. Transverse divides you from superior and inferior, so it's a cross section, and you have to say what level it happens. Oblique sections we don't normally use because it becomes confusing. So here's a picture of it. We mostly use this terminology in imaging, CAT scans and things. Now, this concept of variability is hugely important. I'm going to say that all humans have 7 cervical vertebrae, and this is true unless you have 6 or 8. That doesn't mean that you're not human. It just means that you have a variability. That, a lot of you have a second toe larger or longer than the big toe. Some of you don't. That's all considered variability. In the textbooks, it'll say that the most prominent vertebrae is C7, and it is, unless it's T1. We all don't have the same pattern of veins, especially in the backs of our hands and superficially. Some people have muscles that other people don't. The palmaris longus, 20% of people don't have. Some of you will have a palmaris longus in one hand and not in the other. It really is variability. So everything has to be taken with a grain of salt. There are cavities, front and back. So the dorsal cavity is the one that's the skull and the vertebrae, and the nervous system is found in it. The ventral cavities are found in the front. So this is where the organs are. So there's the thoracic cavity and the abdominal pelvic cavity, which is really one cavity. So it ends up looking like this. Within the cavities there are subdivisions. So pleural cavities house the lungs, the mediastinum houses the heart, and other, like the esophagus and that kind of thing. The pericardial cavity is a subdivision of the mediastinum. There's the abdominal cavity, there's the pelvic cavity, and so if you look at this picture, you'll see again the subdivisions of that. I will talk about membranes at a later date. What I want to jump down to is this. Clinically, we talk about the abdomen as being divided into quadrants. Right upper quadrant, right lower quadrant, left lower and left upper. The liver is in the right upper, the gallbladder is in the right upper. So if a patient comes in with right upper quadrant pain, you start thinking liver, gallbladder. If they come in with right lower quadrant pain, you start thinking appendix or something like that. If they have left lower, it maybe is sigmoid colon. Left upper, it might be spleen, that kind of thing. This is notation. This is clinically narrowing it down and helping focus your thinking. Anatomically, we divide it into this kind of tic-tac-toe region. So anatomists will talk about the right and left hypochondriac region, the epigastric region along the top. So the hypochondriac is below the ribs, that's what it means. Epigastric above the stomach. The right and left lumbar regions. Umbilical region around the belly button. The right and left inguinal or iliac regions, kind of along the line where your leg attaches, and the hypogastric region or the pubic region, which is below the belly button. These other cavities are really found outside the body, and we'll talk about them as we need to, as we see fit.